You won't believe it, but we're actually on one of the elderly care wards at the Royal Berkshire Hospital. We've been through quite a journey in the last year and a half to improve the wards to make them more dementia friendly, and I'm actually in the cinema room. So there's 24 beds, and they're patients who are acutely unwell. They come through our medical assessment units. So they're patients that have come in maybe with chest infections, they might have had falls, they might be more confused. They can stay from a couple of days to a couple of weeks, depending on what they've come in with. A stay in hospital for anybody can be quite disorientating and can be quite anxiety-making, really. We spoke to our local dementia empowerment group, who gave us some feedback about the wards that we're on. They're saying that the corridors can be quite scary. You're not quite sure which door you need to go in. You come out the bathroom, you're not sure which your bay is because they all look the same. So that can be quite daunting. Some of the changes that we've made, some of the big things were to get rid of the nurses' stations or make them a lot smaller and have more of the reception desks, so that then the ward clerks can greet people when they come to the wards, and they can tell people where their relative is, which bed they're in, and which nurse is looking after them, which is really quite important as well.
Beforehand we had flooring that had a speckled effect, and it was quite shiny as well, and patients with dementia or patients who were hallucinating used to think that there were either things on the floor that they could pick up or that there were insects on the floor and that it was moving. Or the shiny effect made them feel very apprehensive about standing up and walking on it for fear of falling. So the floor that we've got down now, we found, has reduced the number of falls in the trust by around about 50%, so it really has had a huge impact.
We've colour-coded the bays. We've gone with a nature theme, so we've got Meadow Bay, Harvest Bay, Woodland Bay and Seaside Bay. So they're all kind of colour coordinated, and with that we've put artwork up above every bed, so you're not just sitting looking at a blank wall anymore.
Generally the wards look a lot nicer. Relatives come up to the ward and say, oh, doesn't it look nice up here now compared to what it used to. Obviously there are a lot of pictures on the walls as well, so it means that people can stop and reminisce, and it gives the whole ward a much more relaxed feeling.
It doesn't feel like a ward. It's very open and bright, and all the bays have different colours, and there's always music playing. And I feel like it's a really positive atmosphere which benefits the patients, but also it's quite nice for the staff.
Since the geography of each ward has been changed and the sitting rooms have been opened up, the nurses have looked for new creative ways of using those spaces and engaging the patients. The elderly care department for a long time has had the philosophy that dining and eating is a social activity, and people eat better if you're eating with people. So these rooms are used for social dining.
We don't have a specific activities coordinator, but staff just wanted to do this. So we had an afternoon tea, we've got reminiscence groups, hand massage, singing for the brain, so a lot of different things which is just helping to improve the well-being of the patients here.
Katie Wells on Burfield Ward had the idea of, after lunch, starting a reminiscing group. The League of Friends were then very generous in purchasing some memory boxes from the Rotary Club, who put together a lot of replica ration books, leaflets given out in the war, instructions for gas masks, home guard and things, different packs, slightly different emphasis for different groups of patients. And we sit down and we lay it all out with some of the old money, play some of the wartime tunes. We discover that we have some good singers on the ward, and once we even had a lady got up and did the foxtrot to Glenn Miller. It's wonderful. At the same time, really, we had the idea of a Songs of Praise.
This came about as a Make a Difference initiative which the hospital runs. People can come and sing, members of staff who are non-clinical, clinical, everybody who wants to make a positive difference in people's lives. They are really lovely sessions. They bring lovely memories, old memories. Most of them, they are in dull moments, but once we leave, the spirits have been lifted up, which is really good.
We have had some patients who sadly had to come back into hospital after they've been here for a bit, and they've actually wanted to come back to the wards here. They've wanted to come back to the elderly care wards because they appreciate the care and the changes that we've made from previous experience.
We do get a lot of positive feedback from families and relatives. It's a very positive, bright, cheery atmosphere, so they like it too.
I trained in the Royal Berks for 3 years as a registrar, and I knew I wanted to come back here as a consultant because of the staff that work here. They're so dedicated and they really want to improve care for patients.
Basic nursing care, which is often what you're giving on an elderly care ward, can be very repetitive, and this gives you something that's out of the ordinary. You see the person, not just the patient, and I think then you're going to be better equipped to meet their individual needs, and that, I think, gives high quality nursing care.